Good afternoon and welcome to this briefing for the House Health Committee. I'm Delegate Heather Bagnall, Chair of the committee. I ask for your patience if we encounter any technical or streaming issues. This briefing is being streamed on the Maryland General Assembly YouTube channel. Panelists will control the transition of their slides, and before this briefing, all members were emailed a copy of each presentation. If you do not have a copy of these documents, I'm not sure why, because we also just handed them to you. But if you don't have them, just let committee staff know. Please note that food and beverages are not permitted in the gallery. Delegates may have drinks at their desks, as these meetings can run long and hydration is quite necessary. Please make sure to turn off your phones or silence them at this time. And if a member is not present in the gallery, please understand that they may be attending other official meetings or in other committees on their bill hearings, but they will remain informed of our proceedings. Please adhere to our usual committee rules of one question and one answer from the panel, not one question and one answer from each panelist. And please keep your questions shorter than the answers. This briefing is scheduled to conclude in about 45 minutes. It is currently 1:28, so we will be concluding by about 2:15. And today we will have a briefing from the Department of Aging on the Longevity Ready Maryland Plan. Welcome.
Good afternoon, and thank you all for being here. I had the pleasure of sitting through the previous briefing, and so many things close to my heart were discussed in that, and we're looking forward as the Department on Aging and partnering with our sister agency on tackling a very complex issue of ensuring that there is appropriate housing and appropriate care for older people. Chair Bagnall and Vice Chair Cullison, I particularly want to express my gratitude for being here in front of you today to talk about this very significant initiative in our state. At Maryland Department on Aging, our mandate is very clear. We must balance the urgent needs of today, many of which you heard in the previous briefing, with the systemic transformation that's required for tomorrow. We're navigating a period of profound demographic and political disruption, with federal changes that are occurring to safety net programs that have existed for many years, major policy changes, as well as the change in the population here in Maryland. But at the Maryland Department on Aging, I'm really proud of the fact that we're not just reacting to the changes before us. We're moving forward by building a plan for a longevity-ready Maryland. So we have a vision, a very inspirational vision, I believe, that every resident in Maryland, every person in Maryland, can lead a life that is healthy, financially secure, socially connected, and purposeful, full of meaning across their full lifespan, possibly up to 100 years. Being a centenarian is no longer something that gets recognized as a great big deal. Used to be, you got to be on TV and you got a letter from the president and everybody was really excited, and now it's sort of like, oh, 100, okay, good. The role of the Maryland Department of Aging, we are designated as the state unit on aging. And our job is to distribute, to monitor and report on federal and state funds that come to our agency on behalf of older people, the services and programs that they need. But very importantly, we are tasked with planning for older adults, advocating, creating policy and legislation that will address the needs of older Marylanders today, but also the future older Marylanders. And I am so happy to say we are all the future older Marylanders. This is not someone else, it is us. Today's briefing is to explain our role in planning policy, legislation, and advocacy as we, in fact, prepare for our ever longer lives. Through the Longevity Ready Maryland Plan, we are addressing the population disruption of falling birth rates and longer lives. So what do we mean by population disruption? Today in Maryland, 2.3 million people are age 50 or older, making up 37% of our population. Everybody who's 50 is thinking, God willing, I will be 60 in 10 years, 70 in 20 years, etc. And in just a very few years, our 60-plus population, which is some of our 50-year-olds today, will make up more than a quarter of the state's population. With the 85-plus group, those over the age of 85, the fastest growing segment of the population in Maryland. Historically, 18-year-olds far outnumbered 60-year-olds. I'm part of that boomer generation who, created one of the biggest cohorts of young people the country had ever seen. Today, however, that has shifted. In Maryland, the number of residents aged 15 to 19 and those aged 60 to 64 are almost perfectly balanced. This is a population growth map, and unfortunately, we can't show you as a live map where it changes color as we look at it, but if you go on our website, you can see that, along with many other statistics and data points. In 1970, 4 counties had a 35% or higher population of residents over the age of 50 in Maryland. That the dark green on the map is what indicates that. These numbers are expected to continue to increase as advances in technology and healthcare help future generations live longer and hopefully healthier lives. So, Deputy Secretary, are you advancing it for me?
I'm advancing.
Okay, so what we're seeing is as the color darkens across the state, so does the population of older people. And you can see where we're headed. And of course, this is a great blessing. We're headed to living longer lives all across the state, but it's also presenting great challenges and great opportunities. So what do we know? We know that 21st century needs really are going to require new approaches, and that we cannot use last century policies, programs, and systems to address today's aging population, and of course, what you see here on the map, the future of Maryland. Longevity Ready Maryland, or LRM, plays a pivotal role in effectively addressing both the opportunity and the challenges. LRM was signed by Governor Moore in July of last year, becoming the state's first comprehensive 10-year multi-sector plan for aging. This is a bold, data-driven initiative to coordinate and track policies across state agencies and to build a longevity ecosystem to support Maryland's aging population. By embracing an all-of-life course, all-of-government, multi-sector approach to longer lives, we can ensure Maryland is ready, not just for today's older adults, but for our future generations as well. We've set a national example here in Maryland. Our plan is the first in the nation to combine the federally required 4-year state plan on aging with the 10-year multi-sector plan. This allows us to braid effectively funding and policy for better outcomes in the future. The launch of Longevity Ready Maryland sends a clear message, regardless of shifting federal policies. Maryland will continue to put the well-being of older residents front and center. During these challenging times, this is a positive thing that we can bring back to our neighbors and constituents. We are committed to the well-being of older people, their families, and caregivers. And this plan is a way that we demonstrate that effectively. So we didn't come up with this plan by ourselves. This was a massive stakeholder engagement process. We gathered input from community members with lived experience. That's code for older people. Experts in health and aging, state agencies and local governments, community-based organizations, and older adults across suburban, urban, and rural areas. We learned from this extensive, almost 2-year engagement process, what were the chief priorities, needs, concerns, desires of our stakeholders. And from that, we created 4 epic goals: building a longevity ecosystem, promoting economic opportunity, preparing Marylanders to afford longevity, and optimizing health, wellness, and mobility. One of the most important things that we know we are facing is making sure that our health spans equal our lifespans. These ambitious and comprehensive goals will guide our work for 10 years to come. The plan itself is designed to be dynamic and to change in ways that reflect evolving conditions. Continuous monitoring, updating, reporting, and stakeholder engagement will ensure that it remains relevant. However, the commitment is to use the lens of longevity, to use the Longevity Ready Maryland framework for preparing for future lives. This will remain consistent, as will our commitment to older Marylanders, their families, and caregivers. Earlier this month, we submitted our first LRM annual report to the governor's office, highlighting some of our significant foundational work in 24 and 25. Maryland was one of 4 states awarded a competitive $490,000 caregiver strategy grant from the Administration for Community Living to improve awareness of resources across state and local agencies among Maryland's diverse population of caregivers. Maryland has directed $220,000 in aging in place grants to align with child poverty targets, areas of enough grants, supporting state investment in the full lifespan within under-resourced communities. And I raise that in particular because this is an all-of-government, full life course approach. And one of the things that we know is in these communities where significant numbers of children live in poverty, many of them are living with their grandparents who are also living in poverty. And that is the population that we want to bring resources to and impact so that the whole family can be healthier and have better quality of life. We have redesigned Maryland Department on Aging's pre-Medicaid long-term services and supports program into a $20 million service, SOAR initiative, that will improve reach and effectiveness of services, reduce administrative burden, and in the long run, allow more Marylanders to age in their community, in their home of choice. We piloted a memory care family checklist with Johns Hopkins, which was announced, the launch of that was announced this week. That was a collaborative effort with the Maryland Department on Aging, with 211 MAP, and with Johns Hopkins. It's a checklist that lets caregivers answer a set of questions. It produces a personalized care plan and connects them to resources personalized to their needs. In addition to our current accomplishments, we have also identified several priorities coming out of the plan that align with the Moore-Miller's administration. These priorities are within our direct operational control, and they mirror current federal priorities as well. So among these are increasing caregiver support for caregivers in Maryland, increasing healthy nutrition and food access, and ensuring that older Marylanders and their families know how to navigate the very complex system of services and resources that are available by enhancing the Maryland Access Point service and improving coordination with our area agencies on aging, our Maryland Information Network, and our sister agencies. We're also looking to codify into law LRM, and we'll be talking to the committee about that later this afternoon, and working to increase stakeholder engagement and philanthropic partnerships. So if you've had a chance to look at the LRM plan, it is on our website, and I hope you also have received paper copies. There are way too many recommendations in the plan for us to review all of them today. So we're not going to try to go through 78 recommendations in our hearing. I know you are very happy to hear that. We are really encouraging you to go on the website and look at the full plan, though. So we pulled out a few of our EPIC goals and also a few of our recommendations so that you can kind of understand what it is we are hoping to accomplish. So one of the EPIC goals that aligns closely with the work of this committee has to do with promoting economic opportunity. With this goal, we recommend strengthening Maryland's commitment to family caregivers and to the fiscal and social actually the issues that come to families because of caregiving that mean that they have very difficulty maintaining their financial security and the quality of their lives. The state's 760,000 unpaid caregivers provide essential support to our state's long-term care infrastructure. They offer 710 million hours of unpaid care. 7 in 10 caregivers also work part or full-time. 40% of caregivers provide complex medical tasks. Most have received no training to do this. One way to achieve this is to continue to improve Maryland's No Wrong Door access, which provides information and supports for families and caregivers. And we've done this by deepening our relationship with the 211 and Maryland Information Network. We've also are developing an AI chat box, which we hope will help expedite people who are working through the 211 or MAP information system to find resources. And we've collaborated with the Maryland One benefits system to ensure that older adult programs are included in the universal benefits screener and application so that older people do not have to go look at some other place to learn about that. We're continuing to collaborate across state agencies to formulate policy that increases opportunities for people to work more years with more flexibility, thus supporting family care across the lifespan. Another recommendation under this EPIC goal is to increase the number of Maryland public and private employers that promote age-inclusive policies and practices. This can be accomplished by adopting the Certified Age-Friendly Employer or CAFE designation. This is a national standard managed by the Age-Friendly Institute that provides a roadmap for organizations to recruit, retain, and value experienced workers. One of the fastest growing segments of the employee labor population is people over the age of 65. Another key recommendation is to further leverage skills-based employment, apprenticeships for all ages, and more pathways for workers age 40 and older to pursue career changes to in-demand occupations like healthcare, education, and IT. Our governor actually is doing a taped interview for the Longevity Summit for the Stanford Center on Longevity, where one of the things he's talking about is how Maryland is a leader in ensuring that people of all ages have the ability to upskill, reskill, have lifelong learning, and continue to have productive, satisfying employment well into late life. A really good example of this that we've also recently seen is the expedited pathways that were created for mid and late stage former federal employees who flooded into Maryland following the recent federal actions. And many of them are on pathways to become teachers to help fill those vacancies in our state education system. Optimizing health, wellness, and mobility, of course, is an epic goal and one that is very dear to my heart because it has to do with the very individualized and personal way that we age. And what we know is that currently a person can expect to live up to 8 years in poor health toward the end of their life. I have to tell you, I just read an article in the New York Times about a guy who's 82 and runs mega marathons, like not your usual marathon, but like marathons that are 2 and 3 times that. And of course, we're all going, what does he do? We'd like to know some more about that. Well, all of us don't have to run, mega marathons, but he's lifted up as an example of we do by birthright have the ability to live a long, healthy life. And if we're not, it's because there are things we are not doing to make that possible for all of our residents here in Maryland. So improving equitable access to health care is essential for both individual dignity and to the state's long-term stability. We recommend exploring policy reforms that incentivize that access. And you heard some of that discussion actually in the earlier briefing. We have also begun the policy work through our SOAR program to redesign the way services are made available earlier in the life course to help people stay in the community independently for as long as possible. And we're working on the capable model and the HEAD model, as well as the rural health transformation initiatives. So we will continue to participate and influence these initiatives to ensure that the perspectives of older adults are included in the planning for the delivery of programs and services from these massive federal programs that are coming to our state. While the initiatives and recommendations I've mentioned support Maryland's older population, a codified framework will help ensure they survive administrative shifts and solidify the state's commitment to preparing for longer lives. To ensure this progress is not temporary and to guarantee that Maryland's systems remain resilient against shifting federal landscapes, we are introducing the Longevity Ready Maryland Act this year. Features of the Longevity Ready Maryland Act include establishing LRM in the permanent broader work of Maryland Department on Aging, expanding the role of the Maryland Commission on Aging, and requiring comprehensive updates to Longevity Ready Maryland every 4 years, accompanied by a publicly available annual progress report. We will be talking with you after the break about that important bill. In addition to the LRM Act, we are also supporting some of our sister agencies, and one of the bills that I'm most happy about does speak to affordable housing, available housing, generally the housing supply for what is called both starter homes and silver homes. And that's an example of recognizing in these big policy and legislative actions that we are using the lens of longevity and including older people in these initiatives. So in conclusion, we're asking of the committee to consider adopting a longevity lens to your work this session and in the years to come. And what do we mean? We must recognize that life doesn't pause at 65. And in fact, many Marylanders will spend 3, maybe even 4 decades in post-retirement. If they're very lucky, some of them will get to spend it in public service, like I have. And by using this lens, we acknowledge that the policies we set forth for our youth and workforce today will directly dictate the trajectory of their health, their financial security, and independence. We're also asking that you help amplify the Longevity Ready Maryland Plan during the session when you are working with other government agencies and other levels of government. And most importantly, we are asking that you work with us and that you allow us to partner with you on this all-of-government approach to preparing for longer lives. And as I'm closing out my testimony, I want to take this moment to recognize and express my deep gratitude to Delegate Cullison, who from the very beginning supported our efforts around bringing a multi-sector planning approach to Maryland. And also to thank other members of this committee who have been so kind and generous with your attention and your time as we've talked with you about this important work. Thank you very much.
Thank you very much for your presentation. I'm going to open it up for questions, starting with Vice Chair Cullison.
Thank you, Madam Chair, and I want to thank you for your work. I mean, it is what I find in this presentation. We have high-level, lofty goals, but you also have some very concrete ways to address them, and a lot of times that's missing when we engage in this big strategic planning endeavor. I do have to ask a question, though. And my question is, could you speak a little bit to the budgeting regarding the fact that all of the agencies have some funds that are programmatically assigned to the kinds of things that LRM is doing? Can you speak to that a little bit? Give examples, perhaps?
Yes, thank you for that. And it's such a critical aspect of the way we approached both the plan and also the bill that we are proposing. One of the things that we recognized early on is that, you know, the Department on Aging is a small agency. We receive about 5% of the funds that actually impact the quality of life of older people that come into Maryland. They come into our sister agencies, and so we identified early on that what we needed to be able to do was to influence our sister agencies in how they thought about the use of their funds to impact those issues that specifically are addressing concerns of older people. So I would say an example of that does have to do, for instance, with the work that we've done with the Department of Housing and Community Services, not only about with the bill that they're presenting now, but we've been very involved around addressing the issue of the fact that one of the fastest growing cohorts of unhoused people is people over the age of 60. And what are the ways we can leverage our resources and their resources to impact those issues. Looking at the work in the Labor Department, we're particularly pleased that there is an emphasis on hiring on a skills-based basis and also using apprenticeships to keep people in the workforce and move people through their full life course with employment that's purposeful and meaningful. That's money that doesn't come into our agency. It comes into the Labor Department, and it can be used to affect that change. So what we said, especially in these years of very constrained resources in the state, we think that in the immediate environment, that our best opportunities is to be sure that the funds that are available take into account the very specific needs of older people, their families, and caregivers, and are directed in those ways through our sister agencies. I do think that we have to be very realistic about the fact, you saw the map, as it turned darker and darker and darker, given the population shift, we do have to be realistic about the fact that we do not have adequate resources currently directed toward that growing population. And there will probably be in the future, maybe not coming directly into the Department on Aging, but there will be a need to continue to identify current assets that exist in the state. We do have assets that currently exist in the state directed toward older people, but also we will have to be willing to identify future resources. And that's why I'm looking forward to working with all of you across the future years around this 10-year plan, because it's those very granular and important decisions that we will have to make together as we move forward. Did I answer your question?
You did. Thank you very much.
Delegate Alston.
Thank you, Madam Chair. Madam Secretary, I just want to thank you for all of the work. I'm always so enlightened every time I hear you speak, and it's just a pleasure to be able to partner with you all in this work. I would like you to talk about the map. Are there any health challenges that are driving the lack of older population in our more seasoned communities, like in Prince George's County, Montgomery County, those inside the Beltway areas, if you have any insight as to that. But before you do, I would be remiss if I did not recognize your predecessor, or one of your predecessors, the Honorable Gloria Lawler, former Secretary of Aging, has joined us, who's also the first woman senator for Prince George's County. It's a pleasure to see you in the audience today, Madam Secretary Lawler. And I know we're going to hear from you a little later on another bill, but I could not recognize the president of our Women's Foundation. Thank you.
Well, thank you for recognizing her. That makes me very happy. And she's been a wonderful mentor to me when I've needed help understanding certain things. To your issue, I'm going to talk about something that's really over my pay grade, but that I do know a little bit about. And you're really speaking about a public health issue. We know that in Maryland, depending on where you live, your actual, right down to the neighborhood you live in, your life expectancy can be 10 years shorter than it is in some of the other areas. We also know that certain healthcare issues disproportionately impact our minority communities, and those are, as my friends who are experts in the field of dementia care tell me, if you want to lower the number of folks in Prince George's County and Baltimore City who have the record for levels of prevalence of dementia in the country, if you want to change that, you have to change diabetes, heart disease, and kidney disease. Because the things that impact our health in those areas also impact our cognitive health, because our brain is, in fact, part of our body. And so these are really significant public health issues. And they have to do with prevention, and they have also to do with equitable access to care. And our plan does reflect a concern around education and equitable access. So with our very own limited dollars, that's a priority when we think about access to care, access to education, access to services, but also across the state. It is reflected in the state's health plan as well. And that's part of what I mean when I say we partner with other sister agencies. It's those kinds of issues that really overlap so completely with the work that we do. So thank you for that great question.
Thank you.
Seeing no further questions, thank you so much for this presentation and for the hard work that you're doing. We're going to go ahead and conclude this briefing. If you can take us down. And we will.